text it is mentioned as monkey mind, you know. Mind is called as monkey because people say monkey never be still. It keeps moving here and there. But the aim of yoga is the process of yoga will keep your mind's fluctuation shut, through which we can achieve the path of Kaivalya or spiritual realm, it's called as moksha. Are we clear about this? If you have any questions, you can please type in the chat box. Yoga has set of tools and techniques to attain the equipoise of the mind. It is not to stop the thoughts, which is impossible. Are we clear with this? Type yes in the chat box if you're clear. Ramoji Raghav, you're saying no. You have a question here? Okay, so you can type in the chat box. You can type your question in the chat box. Okay, so now let us understand this Panchakosha theory. See, as we have so many theories in Western psychology, okay, we also have lots of theories in yoga and Eastern philosophies, which not many people try to understand better in relation to psychology. All right. I tell you, why did I end up doing yoga psychology? Why am I so interested and intrigued by these concepts? Is when I was doing my PhD, I wanted to work on Indian psychology, but my professor said it might need a lot of time, it might need a lot of expertise. So he tried to take a few concepts and leave rest of the things. Right? I worked on spiritual intelligence in my PhD. But then when I did my postdoc, when I applied for my postdoc, there was this panel of 7 people in ICSSR. Okay, I spoke to them about yoga psychology, yoga system based counseling. Okay, then a lot of people said in the panel itself, they said, no, it's pseudoscience. How can you talk about chakra system when you can't really see chakra? Right? So that is when I spoke to them. I told them about, see, you talk about Sigmund Freud, you talk about indigo, superego, you talk about iceberg model, which has already been mentioned as Manobuddhahankara in yoga. Right? Carl Jung's collective consciousness has already been mentioned. Abraham Maslow's needs hierarchy theory is mentioned in the form of chakras. So all work which we see in terms of papers and publications by this great psychologists have already been mentioned in one or the other Indian scripts. Okay, so this Panchakosha theory particularly has been taken from Taittiriya Upanishad. Okay, so I understood that, see, everything is already there. We are just kind of digging deeper, or maybe this Western psychologist taking the concept of it, giving a nice English name and putting it across. But everybody is trying to get this science to reach each one of us. That way, I appreciate all of them. But let us understand Panchakosha theory as it is from Taittiriya Upanishad today. So it says our body has 5 different sheets. Okay, starting from Annamaya Kosha, which is the physical body which we see. Okay, so these are like different layers of the body. We will go one by one in them. So the first thing is Annamaya Kosha, which talks about physicality of a body, which we eventually develop by eating food. Right from my childhood, right from the inception. When we are in the womb, we have been taking all the nutrients required from our mother through the cord, and then we started eating and developed this physical body. That is Annamaya Kosha. Next comes our Pranamaya Kosha, which talks about life force entering our. So now a lot of people think that the breath itself is prana, which is not true. Okay, so prana takes breath as a vehicle, as nutrients take blood as a vehicle.
Nana,
Similar,
earphone check, beta. Earphone check.
internet. Can we request you to keep on mute, please?
Huh? Hey, beta. Headphones.
Yes, ma'am, you can unmute and continue. Sorry for the disturbance.
Yes, perfect. Done. So, prana, the life force, uses our breath as a vehicle and gets inside body through different nadis. Okay, the entire pranamaya kosha is a layer which gives the very life force to our body. And next thing, next layer comes manomaya kosha. Manomaya kosha is all about mental strength, all the thoughts, all the emotions you talk about, all the feelings, everything is there in my manomaya kosha. Okay, it all the emotions will come here. We can think that way. Now, Vijnanamaya kosha, this talks about the wisdom and knowledge which we gained over a period of time. Okay, and finally, the Anandamaya kosha, that is the bliss body. People say that is super consciousness, supra consciousness, and eternal bliss and ecstasy. All these things one experience in Anandamaya kosha. But I would say that's a different level altogether. When a person is happy and composed in all the five koshas, then the person gets a chance to experience that kind of ecstasy. All right. So these are the different sheets of with which human body is made. Now, can you show me peeling of sheet by sheet? Sorry, it's not possible. Right? It's all we have to understand because all that we know is only the body. Slowly, slowly, we are understanding about mind. Getting to a soul might take few more years. Right? But for now, let us understand this five kosha theory, which will help us to understand the concept of vyadi, that is disease. Now, so how do we understand the concept of disease in yoga? Okay, so vyadi is the ailments which we are talking about. There are two types. One is adi and vyadi. I'll talk about it very clearly in this slide. Okay. Now, if you see adi, it is because of the mental agitations, and it in turn depletes the flow of prana, and it creates the instability of nadis. If it leads to that, the haphazard flow of prana gets into or results in underdigestion or overdigestion. We talk about gut mind, gut brain axis, right? There is so much of research happening in the food we eat, so much of programs which have come up on gut reset. They say stomach gut is your second brain, right? So people spoke about it 5,000 years ago already. So mental agitations, which leads to haphazard flow of prana in the body, which is very visibly seen in digestion system, either ajirnatvam or atijirnatvam, which talks about underdigestion or overdigestion. Now, if it leads to the instability of nadis, yes, it also will lead to wrong digestion. And all these things together will manifest in the form of physical ailments. That is what we are calling vyadi. So all the physical ailments which we are seeing initially starts as mental agitations. This is what I want you to understand. The pathogenesis of yoga very, very clearly talks about it. When the nadi is blocked, okay, when the flow of prana is improper, which again happens because of mental agitation. So something we understood in a wrong way, some kind of anxiety, right, enhances our heartbeat. Our breath, becomes rapid, right? Imagine a person being in anxiety for some time. He tends to eat overly, or he doesn't eat, or whatever he eats will definitely go through these kind of uh, digestion or over digestion kind of processes, right? If it continues, it manifests in the physical body, that is the Annamaya kosha. So with this, there are two types of physical ailments which we see, that is two types of vyadi, which is Adija and Anadija. Okay. Anadija talks about all contagious diseases and infections, like earlier which we used to fight, cholera, lots of rest of all contagious diseases. but our focus is more on Adija again, which talks about Sarang Samanya. I know these terms are little it might be little new for all of us, but let us put little focus to understand it. So the Sara talks about all it related to the cycles of birth. It talks about lot of vasanas and samskaras. They say the reason for this disease could be because of the actions which you did in your previous births. Okay. Well, ordinary type samanya. This is talks about psychosomatic ailments. All right. Understand the name samanya. It is ordinary type of diseases. Now, what we are doing in this modern society, I think we are kind of overrating when we talk about all the mental health diseases or disorders. Of course, it can manifest to a much larger problems, but initially it is just samanya. If you understand this concept of disease in yoga, we will get into the comparison. Okay, so yoga says disease starts from Manomaya Kosha. It starts as a very simple conflict, usually conflict of doing or not doing, right or wrong, things like that, and it affects Pranamaya Kosha, which creates imbalances in prana. If it continues like that, there is a analogy explained. When an animal is hit by an arrow, it cannot run properly, it staggers, right? Similarly, when some conflict is hit in the mind, that is manomaya kosha, it's like arrow hitting the animal. As the animal staggers, the prana in the body, the very life force in the body, goes out of balance, it staggers. Okay, and if that happens continuously over a long period of time, it naturally affects Annamaya Kosha, which leads to the structural alterations. So when we talk about this Annamaya Kosha alterations, we can even talk about genetics. We can even talk about the changes which happened over a period of time in genes, genetic structure also. So now the modern science accepts it similarly. Modern science also states it all started with a psychological disturbance, and it creates some kind of functional disturbance also. So when you take EEG, when you talk about epileptic person, silent seizures particularly, proper epilepsy is very clearly seen. Okay, but sometimes the patient, I have a patient like that who is suffering from silent seizures. People misinterpreted as some kind of PTSD. Okay, that was actually misinterpreted, and then I thought it could be a silent seizures. When I have gone taken her to the doctor or neurologist, neurosurgeon, so with all the diagnosis happened, so it is very clearly seen that is the functional disturbance which started occurring. Now, when we leave it as it is without treating, I'm sure it will cause a structural and cellular damage. Okay. So both yoga and modern science are talking the same when it comes to the concept of disease. Okay. Why am I talking about the disease as such? Because yoga always has been talking about human being as a whole. When we talk about psychology, we talk only about mental health. But if you see the definition of yoga, it talks about the complete health, health and different levels, right? So that is why it is very important for us to understand the concept of psychology. Mental health in yoga. As such, we have to understand the concept of disease as such. Now, I hope it is clear. This is actually the picture taken from a book which talks about clinical yoga. This is the effect of stress on kosha levels. See, now we all know stresses of two types, right? Stresses of there is eustress and there is distress. These are very common terms which we use. Now, if you see the eustress and distress, positive stress and negative stress. Okay, both positive and negative stress will create some kind of changes in our pranamaya kosha. Okay, even to some extent in annamaya kosha also. All right, imagine that your wife is in labor room, okay, struggling with the pain. You undergo some kind of stress. Okay, and if it is positive stress, it's okay, you take care of her, you keep everything ready. Once the baby comes, what to do, you will keep everything ready. But that stress disturbs you so much so that you run away from the hospital, hide yourself somewhere. Your wife will miss you naturally, right? So you understand this concept of human distress very clearly already. Now let us understand the effect of stress on kosha levels. Okay, the complete body as such. Now, if you see Annamaya Kosha, we will come from this side. Okay, our right to left. Stress affects organs. Stress creates lot of degenerative changes. Okay, there is a recent study which also said that if you constantly look at blue light, your hair, particularly this part in the front side, the hair becomes that grays so fast, and even you get some kind of crow's feet on your face. You start developing wrinkles, right? So it is very clearly seen in your body, and it may also create carcinomatous changes and inflammation, which is the reason for all the diseases, I would say, and even wasting. Eventually, it would your body would progressively become weak and weaker, right? Now, what happens because of stress in pranamaya kosha? This is a very simple thing. You see a snake, what happens? You see a dog barking. What happens? Immediately your breathing becomes haphazard, right? Your palpitation increases. There is this hypertension. See, I'll tell you, prana is very important. Breath, moment I say breath you relate it to lungs. You say it is important for oxygen and all, right? But prana is basically the energy element of the body. Whatever we need energy for, we need energy for heartbeat, we need energy for the food to get digested, we need energy for the reproduction, we need energy for the excretion, you need energy for all the activities which should take place in the body, right? So pranamaya kosha talks about that energy. You see, you when stress affects your pranamaya kosha, you develop some kind of tremors, you develop some kind of sleeping disturbances, and lot of people, those who kind of suffer from autoimmune disorders, okay, you can understand that the pranamaya kosha is severely disturbed. Okay, all the psychosomatic things can come from pranamaya kosha. That is what I wanted to mention. Okay, and then manomaya kosha, so this is the mental body. What happens if a person has wrong knowledge, or if a person doesn't have right knowledge? Over ambition develops. That's when people get into the mode of competition. Okay, because of which become restless. Now let us understand very simple thing. A lot of students come to me saying that my CGPA has gone below 7. Now I may not get a job. Okay, I ask them, why did you come to IIT to do a BTech? They say, for a good job. So do we study BTech for a good job, or do we study whatever we study for a good job? What do you think? I want you to comment in the chat box. What are we studying for? Whatever we study, we study for job, is it? For excellence, okay? Hey, is my pace okay? Do you all understand what I'm saying? Do you want me to go little slow, little fast? Can you please type in the chat box? Okay. All right, Sambasiva Garu, thank you so much for the feedback. All right, thank you so much, Varnagaru. Thank you. Yes. So we study for enhancing our knowledge. Vidyarthi is the one who seeks knowledge, right? Now, this understanding is not there in many of the kids these days. Okay, forget about parents, that's a different story. We'll talk about it later. But this very right understanding is missing in students. Now, they are studying only for the sake of job. Now, they study well. If they don't get job, what does it mean? They feel that they lost. That is the reason they are committing suicides, getting into depression. A lot of things are happening, right? And similarly, I'll tell you another simple example. A mother feeding a baby, okay? What mother feels is she fills that complete bowl of food with some nice vegetables and stuff, nice sambar which she has made for keeping the baby in mind. But when the baby doesn't complete this full bowl of food, mother gets distressed. So mother wants the baby to eat the complete food. Is it good or bad? Is it right or wrong? What do you think? This simple activity of mother feeling very bad because her child is not completing the bowl of food, whatever is given by her, this creates some kind of restlessness in the mother. Most of the times, right? It creates a lot of restlessness in the mother. So, this wrong knowledge is actually putting her in the pressure, because of which her anxiety increases, because she starts thinking about what if my daughter is not eating well, what if my son is not eating well, what if he doesn't get proper strength, what if his body is not ready, growing properly, blah, 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 blah. These are called fluctuations. These are called mental fluctuations, right? So you keep thinking about what if, what if, what if, it creates anxiety. See, a simple wrong understanding or lack of right understanding that the baby eats how much ever the baby wants. Yes or no? Naturally, babies throw up, if you start pushing, food into the mouth, they keep doing like this, they keep nodding their head. There are a few babies who spit also. Right? They don't want it. They know how much they want. Right? So, not understanding this simple thing that mother is developing some kind of anxiety, which may lead to fear, which may again lead to sorrow, anxiety, blah blah blah, everything will follow. All right. So, this is what a stress can do to your manomaya kosha. Okay. Now, what is vijnanamaya kosha? Now, again, stress dominates your capability of taking decisions. Stress triggers ignorance. Okay, if you're under stress, you don't know what are you doing. It triggers your ego. Why can I not do? I have to do it. I will do it. Right? And stress also, see, Anandamaya Kosha, how it impacts Anandamaya Kosha is, if a person is under constant stress, okay, all the other koshas are damaged, okay, because the ignorance of the person is triggered in Vijnanamaya kosha because of stress. The person, the individual, will end up doing wrong actions for which there are consequences follows. So they say the drive of residual impressions from previous birth, previous samskaras, that will get triggered when the person is under stress. Okay, that will get triggered. Now you see the story of Prahalada. What is Prahalada's father's name? Does anyone know? I know a lot of Telugu people are here. I know it's a very silly question, but still, I'm trying to keep you engaged. ప్రహ్లాదుడి నాన్నగారి పేరు ఏంటి? Who is the father of Prahlada? Anybody? Yeah, correct. Okay, I see few people active. Very good. Very good. So when Hiranyakashipa was under a tremendous stress of knowing who Lord Vishnu is, he is under stress. Why the hell my son is talking about my enemy? Why the hell my son is chanting my enemy's name? Okay, he got into tremendous stress and he has gone to a level of killing his own son. Yes or no? Right? So these are all his past impressions, past previous but samskaras which fell over. That ignorance of not having the right understanding, and the ignorance and the ego of I am the God led to attempt murder his son. Right? So this is what it is driven to Anandamaya Kosha also. Now, are we clear how does the stress affect our various kosha levels? Are we clear with this? Can we pause here for a minute? Yeah. Okay. If you have any doubts here, you can please ask me now. Okay. So now let us move ahead and understand how do we manage. How does yoga help one to manage different stress at different levels of kosha? Okay. As I told you, yoga is a holistic science. Yoga has always been used to attain the spiritual realm. Usually, it's evolving person as a whole and attain kaivalya, nirvana kind of stuff. However, in recent years, there is a lot of research which has been done in using the yoga philosophy in psychotherapy. So, by definition, we understand psychotherapy is to help person analyze the wrong patterns of thinking, or things which are not helping him, or a professional trying to give the guide right understanding, helping people understand their own problems. Right. So it has already been there in yoga, if you ask me, and we try to manage diseases and stress at these different levels again. Annamaya Kosha, Pranamaya Kosha, Manomaya, Vijnanamaya, and Anandamaya. Okay. Now, if you see this picture, it talks about different streams of yoga. It talks about therapeutic measures. Okay. Now, all the problems in Annamaya Kosha, what kind of stress she must be going through though? Okay, one second. I get a chat message. Why few mothers exhibit extra craziness, not allowing particular family members only? What kind of stress she must be going through? Okay, so I will answer this question a little later. Okay, I got your question. All right. So now, all the diseases which are already manifested in Annamaya Kosha, that is a physical body, Hatha Yoga is something which helps a lot. Okay, Hatha Yoga talks about using your body during lot of asana, right? That is dietary modifications. These things will help. Okay. Now, a person comes with migraine to us. Yes, a person can also come with irritable bowel syndrome. Okay. We know as psychologists that there is some kind of underlying psychological problem or some kind of stress that is being manifested in this form of migraine or IBS. We also have a lot of psychosomatic disorders, people coming to us, right? So how can we help them with Annamaya Kosha is helping them do some asanas, some dietary modifications. Okay, it will help them to see changes, maybe in a less time. Now, next thing is Pranamaya Kosha. So Kundalini Yoga is a branch of yoga which talks about the prana flowing in the body. All the Shat Chakra system will come here. See, if you see, as we have different types of psychotherapies, we have CBT, we have RDBT, we have ACT, we have solution focused therapy, we have so many therapies, right? So, similarly, you can consider these streams of yoga as different therapies. So Kundalini Yoga talks about different pranayamas. So people say you do Ujjayi breathing, it will give you strength. You do Brahmari pranayama, it will help you to sleep better, right? And you do this box breathing to come out of anxiety. So there are so many breathing practices which you can do in Pranamaya Kosa. It also talks about Kriya. I was astonished, I was really amazed to read this paper. There is kriya called Jalaniti in yoga. So what Jalaneti does is like you have to pour water through one nostril and it comes automatically from the other nostril. Okay, this is a very simple kriya. I would say I think this is the only easiest kriya next to Krataka. But the simple act of doing this Jalaneti will also enhance the insight of a person. Okay, people suffering from schizophrenia, of course, pharmacotherapy is very important. Alongside, if you ask them to do this kind of kriyas by an expert, there is the relapse of schizophrenia is much lesser. It's been scientifically proven. Okay, so that is what Kundalini Yoga can do to you. Next, coming to Raja Yoga. So Raja Yoga talks about lot of meditation practices. It talks about keeping all the sense organs focused at one particular point. Okay, it talks more of dhyana and samadhi. It says you have to kind of expand your awareness. What you know is just the drop of our ocean. So understand, get into right understanding of things that will help you. Now, people say the goal of human being is to attain moksha, right? You should also know dharma, artha, kama, moksha. These are the four things which are also explained. Right? Dharma, follow the eternal rules. Artha, money, materialistic things are very important. Okay, you cannot just, I would say, no, I will go do yoga, I will do pranayama, and I will feed myself. It's not possible. Definitely, you need money, you need food to live, right? So, artha is very important. Kama, the desire is very, very important, and which leads to moksha. Okay, so this awareness should be there for everybody. That Raja Yoga will teach us all these things. Okay, if a student knows, let's understand a young guy, okay, maybe out of 10th class, if he understands about Dharma, Artha, Kama, Moksha very clearly, he would not run after jobs. Okay, he would not even leave everything and go away. A lot of people think yoga, samadhi and all, people leave everything and go away. No, there are many raja yogis who is very much in the society like us. You take Sadhguru Jagi Vasudev, you also take Sri Sri from Art of Living, and you take Guru Pashupati from Akhada. There are so many yogis. Okay, there are so many yogis who are living just like us. Okay, but that expansion, the awareness is so much expanded. Okay, these things we can help people with. When a person comes with confusion, we can talk, we can take help of Raja Yoga, and we can help them, right? And Jnana Yoga, Jnana Yoga talks about spiritual discourses, the psychology, psychotherapy and counseling. We can create some kind of awareness about health to a person. And Anandamaya Kosha talks about Karma Yoga. Okay, person with depression will come to you and says, I'm not interested in doing anything. But once the person is directed, the person can do. Make the person do certain yogasanas, make the person do this, focus on Annamaya Kosha, the Hatha Yoga thing, slow Surya Namaskaras, slowly, he understands that it is helping my body. But whatever work I am doing, I should not expect the results of it, but understand consequences are always there. Okay, so this is how we manage stress and diseases at different levels. So, depending upon the problem that a person comes to us, okay, I would kind of stop screen sharing. Okay, so depending upon the problem that a person is facing, as a psychologist and a holistic psychologist, what we do is we try to understand the complete this same thing. We also take this MSc. Proper history is taken. Everything is done. All right, but we go one step in depth, and we also understand which kosha has impacted. Okay, and we also understand which chakra has depleted. There are many other theories which will help you to holistically analyze a person. Now, you tell me, when we help any patient or a client in different levels. Okay, we also talk about relationships, right? Social health is also very important. We also talk about it in the expansion of awareness, okay, in Raja Yoga. So now you tell me, when we deal a client at all these levels together, okay, do you think the person will not be able to come out of the disorder? If you ask me, like Rajinikanth's case, it's jujube for anybody to come out of disorders. Only thing is, people say yes, yoga is a very lengthy process. It takes a lot of time. Blah blah blah. Now, what is people teaching in mindfulness? DBT, mindfulness is a very important concept, right? We teach the mindfulness. So it's all originated from yoga. Now the concept is simple. Client with different problems, analyze them, which kosha is impacted by the kind of stress the person is going through. And we know the reason for disease is in the Manomaya kosha, which is the conflict arised. Understand the conflict, annihilate the root cause of it, then the person is happy. Now, once the root cause is removed, I'm sure the relapse cases are going to be very, very less. If you do for personality disorders, if you do DBT, it's a lengthy process, number one, and the relapse is much higher. Even OCD, the relapse in OCD for CBT is almost 90%. It is much, much higher. And there is a work going on in NIMHANS which talks about work going in NIMHANS which talks about yoga therapy for OCD. It is really going good, and they see that relapse cases are much, much lesser. Yoga therapy is even helping in bipolar disorder. There are so many benefits, so many papers. I cannot share it now because of the time. Uh, but please understand, holistic health is possible with indigenous psychology, Indian psychology. I would be very, very happy to take questions if anybody has. Any questions? Okay. So, okay, I got a question before. Why few mothers exhibit extra craziness? Not allowing particular family members only. What does it mean? Can who asked this question? Can you please unmute and ask?
Ma'am, please let me know from others. Please type in the chat box if you're able to unmute or not. If you're not unable to unmute, please let me know. I think there is no option for them. Yeah. Please unmute yourself when somebody are asking the question. Remaining, please be in mute. Yeah. Ma'am, as asking anyone any questions, you can.
Okay. See the question which a learner asked. Okay, why certain mothers behave extra crazy? Not allowing anybody. If I understood it right,
Yes,
which
yes.
means the mother herself wants to take care of the baby.
No, no, no. The thing is like she is not taking care of the baby, but she's not allowing only particular family members like her in-laws. But she is hiring a maid. She hired a cook. Everything. She's allowing every person to touch. Right from the day one, she's not letting her in-laws to touch the baby.
Got it. Got it.
So
Got
what kind of stress she's undergoing because there is no wealth issues.
it.
There is no health issues as such. The
Mm.
only point is like the parents are unable to understand, even the husband is unable to understand why that uh, crazy behavior she's exhibiting right from the duration of the pregnancy time.
Does it happen with in-laws or with her parents also?
No, 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 only with the in-laws.
Yeah. So see, again, it's a wrong understanding, right? Or there is no right understanding. So she has to understand that her in-laws will equally take care of the baby, or maybe they can take care of the baby much better than the maid, right? It is a very simple misunderstanding or conflict raised in Manomaya Kosha.
Okay.
That's a very
So,
simple answer.
in this
But
case,
if
how
you
how to deal with the clients, means like that particular client? What are the suggestions we can uh,
are
suggest them when they come with certain problems?
yeah, first thing we should understand is as a psychologist, we should not suggest anything just like that directly. Okay,
Yes.
we have to understand what is she actually thinking about her in-laws, or you should also see has there any thing happened before. Okay, all these things we have to consider. We cannot just like that say it is, but
She
if you
has a case
ask,
mentioned that she has a case like she faced a failure marriage earlier, and this marriage only the her in-laws only found this, and they liked the girl and they bought her.
correct, I get it.
So in-laws are very much they are understanding that in the first marriage the failure whatever she faced, maybe that is what it is blocking her, the hindrance, the bonding between them, that is what they thought. So they are very patient in this.
See, the
Uh,
problem is not, the problem may not be with in-laws also. The problem might be with that girl it herself, she herself has a problem. So, right understanding is something important about her in-laws. So, you should understand what kind of perception she has about her in-laws. Number one, what triggered that kind of perception? What is she thinking about her in-laws? And why is she thinking about it? What made her to think about it? So this is something which we have to discuss with that lady and understand. That is what
that
we
lady
will.
is willing
Hmm.
to, they are my client, ma'am, actually. That lady is not willing to open her mouth.
Hmm.
Only thing she is saying is, they torture me. What does they torture?
Hmm. Hmm.
She doesn't have any answer.
Got it.
So we are trying to understand what are the triggers, because it's already she has